Hey guys, welcome back to my medical education YouTube channel. Today I'm going to be covering drug interactions of lithium. This is pretty high yield. I do remember solving a lot of these questions in psychiatry when I was studying for the step one. It didn't appear on the exam, but this is still pretty high yield, and there's a good chance of them testing you on this. So what I've drawn here is the afferent arteriole, the efferent arteriole, the glomerulus, and the Bowman's capsule. Now, lithium, you need to know it has so many, but like mainly I'm going to cover five, which are like very high yield and very clinically relevant. So the first one that we're going to talk about is Nsaids. So what Nsaids do is they vasoconstrict the afferent arteriole, and this causes lithium to get retained in the blood, and that causes lithium toxicity. The second, the two other drugs that you have to be cognizant about are ACE inhibitors and ARBs. So what these do is they vasodilate the efferent arteriole so that the interglomerular pressure decreases, and that decreases the filtration of lithium, and again the same outcome happens, which is lithium gets retained in the blood. Now the other two more drugs that you need to remember for this are diuretics. Ouch, sorry. That's going to be loops and thiazides. So one thing you need to remember regarding the pathophysiology of lithium absorption is that lithium is reabsorbed in the proximal convoluted tubule. And it's very similar to sodium. Both of them are small and both of them have a positive valence. So what happens when loops and thiazides are given is that there's going to be volume depletion, and that results in compensatory increase in sodium reabsorption, and along with it lithium is also reabsorbed because they both are pretty much very similar in their shape and size and the valence. So this is what you need to remember for drug interactions of lithium. It's going to be loops and thiazide diuretics, NSAIDs, ACE inhibitors, and ARBs. These are the ones that you usually will get tested on. So the vignette might read like the patient has been on a chronic maintenance therapy for manic bipolar, and recently they were diagnosed as hypertensive, and they were put on a few antihypertensive drugs, and now the patient is presenting with lithium toxicity usually presents with neurological abnormalities, and they can also have nephrogenic diabetes insipidus. So they're going to give you the vignette something along those lines. So if you remember the mechanism of this, it's always easy to figure out how the interactions do occur. So I hope this was helpful. This is a pretty high yield concept. Do not ignore it, especially in psychiatry. This is a high yield one. They're probably going to test you on this. So and let me know in the comment section below if there's any particular um, topic that you'd like me to cover, especially if it's like a concept that requires more thinking. Maybe it's not just like straight recall. I could figure it out and explain it to you. Thank you so much for listening. I hope this was helpful. Have a great day. Love you. Bye.